Okay, so let's talk a little about breast implants. So there's four different options sitting here. This one is saline, and basically it has a silicone shell and saline filling it. We would take the air out of this before implanting, but you get a sense of what that feels like compared to silicone gel. So they feel different, and they tend to look a little bit different. Definitely if you have, say, very small A cup to start, for example, you're going to tell a difference in how these look. But if you're coming in with a C and you're trying to go bigger than that, you have enough breast tissue to kind of hide either one really well. But they do feel different also. And then checking for silent leak is something you have to think about with silicone implants that you don't with saline. So this one is from Sientra, and it's a smooth shell, and it's a silicone gel implant. This one is a new FDA approved implant in the US, and it's Motiva. And I don't know if you can tell with this lighting, but it has a slight blue hue to it. So if this one didn't have integrity in the shell, it actually lights up even bluer. And then this is a textured implant. So you can tell these surfaces don't look the same. What I really like about this new implant is they have a lot of innovative technology in it, which I think is really exciting. And it's, you know, when we're doing so many breast augmentations every year, I love that when different companies are innovating, and it pushes all of the different brands to innovate and do better. One thing that's nice about this new surface is it has a low inflammation rate around it, and low friction, and lower ability for bacteria to adhere to it, which is really important when you're thinking about something that's in your body for a decade or more. And then this one is a textured implant that honestly I don't really use anymore. The more cases of the BIA ALCL, for example, that came out, and it seemed more associated with the texture, to me, even though it's a really small percentage, for an elective surgery, I'd rather not put someone even at that extra risk. So I don't typically do those anymore. For these, they're both options, and it doesn't mean that everybody has to get the same implant, because say you want a very low profile and a very small volume. Actually, in that case, Sientra has a better selection of size ranges for you. But if you're in kind of the more moderate range of augmentation that you want, then any of the brands are great because they all have a lot of options. When you come in for consultation, these are all here for you to feel, see, and touch. And all of the different implants, like, they have a different feel to them. So some will feel more firm, some will feel softer, some will be more resistant to showing rippling, others are less so. And that doesn't matter in everybody, but in patients with less tissue or much thinner skin, it's something that's really important for us to determine ahead of time that, you know what, you're at higher risk for this. Let's choose a better implant for that situation.